Hey guys, Dr. Tom Chaney here from Living Health Integrative Medicine in Annapolis. In today's video, I want to talk about diabetes and cancer and specifically answer the question that I've gotten from many patients. As a type 2 diabetic, am I at an increased risk for developing cancer? And so looking at the research that's out there, research shows that yes, there is a higher likelihood of a diabetic being diagnosed with cancer when you compare them to a non-diabetic. Now there's a couple of reasons why, and what the research says is that there is a connection between the causes of type 2 diabetes and the causes of cancer, and we're going to go through some of those factors. But also there's the risk of some of these medications that are prescribed for type 2 diabetics increasing the risk of cancer as well. Not all the medications, but some of them out there have shown to increase the risk of cancer. So let's talk about the factors that are underneath that we can get control over to reduce our risk of cancer. So the three factors that most of the research talk about is increased glucose or blood sugar, increased insulin, and also increased inflammation. So in some of my other videos I talked about these more in depth, and I'm going to just kind of recap and summarize. So glucose, we can get our fasting glucose, and you should be checking that when you go in for your annual visit. Also your hemoglobin A1C, that's also a 3-month average of how well you're doing controlling blood sugar. So we want to keep an eye on that, and we want to keep that in a low range. That is going to minimize our risk of cancer and of course type 2 diabetes. And then another one that I don't see checked very frequently is fasting insulin. So this is a marker you should ask your doctor to check and keep an eye on this one, because this is going to give you a better indicator of how well you're doing as far as your insulin resistance and your risk of becoming a type 2 diabetic. So fasting insulin and how these tie into cancer. Blood sugar, some of the research shows that glucose actually feeds the cancer cells. And then insulin, when you have higher insulin, what that does is it actually shows that it encourages cancer cell growth. So we want to definitely get those lower, and that's how we're going to minimize that risk. And then the last one is inflammation. So in one of my other videos, I talked about some of the inflammatory markers that can be looked at on blood work, like C-reactive protein. I talked about homocysteine. So those are some markers that you want to keep an eye on, and those are good to see as far as inflammation in the body. There's some other more advanced markers that we can run, but those are some good ones that you can start with and really ask your doctor on your annual checkup to make sure that they're running, and for you to keep an eye on to make sure those numbers are staying low. Once again, lower the better for all of those. So those are some factors that we can keep an eye on, and check out some of my other videos to get more details on these factors here, because these definitely are something that we have control over, and lifestyle plays a big part in that. So check out the other videos, and I look forward to seeing you in my next video.